So the NIMH funded another study in the 70s. This one ran by Maurice Rappaport at the University of California in San Francisco at the Agnews State Hospital. And the results of this study are akin to what we've seen in the previous ones we've just looked at, that individuals experiencing psychosis or diagnosed with schizophrenia seem to end up doing better in the long run if there is little or no antipsychotic exposure, which aligns with Jung's approach that there is a redemptive quality to psychosis, and if that is allowed to play itself out and come to a completion, that a return to stability and healing can occur in individuals. So in this study, Rappaport randomized 80 young newly diagnosed male schizophrenic patients into drug and non-drug groups. And then there was a 3-year follow-up period. So there ended up being 4 different groups. There was a group randomized to placebo in the hospital that stayed off antipsychotics. Then there was a group given antipsychotics in the hospital that then went off of the antipsychotics when they got out. There was a group given the placebo in the hospital that then went on antipsychotics during the follow-up period, and then there was a group given the antipsychotic in the hospital that stayed on antipsychotics throughout the follow-up period. So if we look at this graph and the different measures on these 4 different groups, we can clearly see that the group that did by far the best was the group given a placebo in the hospital and who stayed off of antipsychotics during the follow-up period. So these people never had any exposure to antipsychotic medications. They had the lowest severity of illness. They had the greatest improvement and change in their clinical status, and they had the lowest rates of rehospitalizations. And then the group that did the second best were the people given an antipsychotic in the hospital that then went off them when they got out during the follow-up period. They had the second best severity of illness, the second best rate of positive change, and the second lowest rehospitalization rates. And then the 2 groups that did the worst were the group given a placebo who then went on antipsychotics, and then the group given an antipsychotic who stayed on antipsychotics during the follow-up period. So there's quite a drastic change specifically between the group never exposed to antipsychotics and the group that had the maximum exposure to antipsychotics. You can see the rehospitalization rate is just significantly worse in the antipsychotic group than the placebo group. So what we see here is what we've seen in John Ware Perry's work at Diabasis, and Lauren Mosher's work at Soteria House, and what Jung described in his work with schizophrenia patients in the early 20th century, that there is a subset of people that can go through psychosis as a process, and that this process can be allowed to come to a completion, and that these people do not need to be maintained on antipsychotics, and that a return to healthy functioning can return to these people, which brings up the possibility that what's going on here is more than just some sort of brain dysfunction, that there is an adaptive attempt going on in the psychosis, and that there is a purpose to what the psyche is trying to do, which should be a part of the consideration when treating these people.